We're back. Hi everybody, my name is Amanda from beautifulnursing.com. I'm so excited. In today's series of 5 minutes or less, we are going to be talking about the P's of labor. So what are the 5 P's of labor? They are passageway, passenger, position, psych, and powers. Okay, so let's dive into these. The first one is passageway. And when you think of passageway, I want you to think of a car on the highway, on a passageway. This car is the birth canal that is going to have its passengers, which is the fetus and the placenta. This birth canal is composed of the bony pelvis, cervix, pelvic floor, vagina, and vaginal opening. So women have different sizes and shapes of their bony pelvis. So let's go over the different types. All right, so the first type of maternal pelvis is a gynecoid. This is the most favorable type of pelvis. It has a pumpkin type of shape, so I drew it with a pumpkin. And here you can just remember that, you know, a lot of people when they're giving birth to their little babies, they're like, oh, my little pumpkin. You know, they call their babies their little pumpkin. And the pumpkin shape is the most favorable, aka the gynecoid. The second most favorable is the anthropoid. This type of pelvis has a human-looking shape, so I drew it with the face of a human. And just remember that we like giving birth to humans, so we do not like seeing an android-shaped pelvis. Android sounds like a robot or an alien, kind of like an alien-shaped pelvis. This has a poor prognosis and usually leads to a C-section. And then the last type of maternal pelvis is a platypuloid. So this one actually is flat, so it looks like the flat beak of a platypus. And the platypuloid also has a poor prognosis and usually leads to a C-section. So if you remember one thing, it's that we like to give birth to tiny cute little pumpkins and humans. We do not like to give birth to aliens or platypuses. When we look at the passenger, we have to look at the presentation, so the part of the fetus that is entering the pelvic inlet first. So the fetal lie, which is the relationship of the mother's long axis, so her spine, to the fetal's long axis, which is the fetal spine. Fetus can be transverse, where it's kind of at a horizontal sideways angle, so it can be parallel or straight. And then when you're looking at fetal attitude, I always remember that with a baby's attitude. When they're angry, they're all flexed up, fists up, okay? So they are having fetal flexion. So they're all angry and fists up. Whereas if they're chill and the fetus has its chin extended away from the chest, its extremities extended, this is going to be fetal extension. And then fetal position, so that's that ROA, LOA, LOT. I have a different video on this that really dissects this information down. It makes it really simple and easy to understand, so you can always check that video out. So finally, the fetal station is just looking at the fetal's presenting parts, so it could be the head or the buttocks, where it is in relation to the maternal's ischial spine. So these two like spiky parts here, how close is it to these ischial spines? Powers, magical powers. These are the contractions, the power to make the baby appear. So uterine contractions work to thin and dilate the cervix while pushing the baby's presenting part to the lower uterine segment. So this is pushing the baby to be expelled out of the uterus each time the mom goes, ah. As far as contractions, there are some key terms that you might hear. One is duration. This is how long a contraction lasts. It's usually measured from start of a contraction to the end of the same contraction. The next one is frequency. Frequency is how often contractions occur. So these are measured by the start of one contraction to the start of the next one. And then finally, intensity, which is just the strength of the contraction itself. And contractions are very powerful. Ooh. All right, so then position. This is referring to the maternal position. So this is not the ROA, LOA. This is talking about how mom has to change positions, maybe sitting on a birthing ball, maybe sitting in the bed, upright, down, standing, they're walking. Whatever the position is, just frequently changing positions to help relieve some of that pain and help with the birthing process. All right, then finally, Psych. This is talking about maternal stress, self-esteem, anxiety that could come with the labor process. So as the nurse, you just want to make sure that you're doing all you can to be a comfort to the client during the labor process by either having calming music, maybe massage, aromatherapy. You could have different positions, giving clear information on procedures that you might have to do, ice chips if the client is feeling nauseous, different breathing techniques to again help relieve that pain and increase comfort so we can have a positive pregnancy experience.
Thanks for watching. Be sure to subscribe.